If I look at this conference, the FOXY has grown tremendously. There are almost around 235 societies in FOXY, and this conference gives us a platform to interact with each other, to come to know what our fraternity is, as well as to know each other, not only at a personal level, but also we come to know academically that how each and every person in FOXY is growing and what are their achievements. And now what change I have seen that each and every FOXYan is so excited to attend this conference and they want to be a part of it. And at the end of the day, the learning and teaching is this conferences is to improve the women's health in India. As our logo says that women's health is nation's wealth. I think we all are working towards our logo and our theme. Yeah, see, scientific knowledge is always gained to see to it that we treat our patients in a better way. So, each one would like to hear from the experts, okay, about the expertise and then apply it to their patients. So, as we have almost 10 halls in our scientific program, the people can choose or they can be focused depending on their own interest that which scientific program they would like to attend, and accordingly they can choose. Yeah. We have 4 themes now: maternal and fetal medicine, which is, yes, any day is very important. Preventive oncology, because prevention of cancer is always should be the aim of every FOXYan. Okay? So, preventive oncology. Then infertility, which is we find as a rising problem today in the coming generation, and the reproductive health. So, these are the 4 themes. Along with that, we have miscellaneous themes. Apart from that, there are different organizations from all over the world who are joining us, like a Royal College of Obstetrics and Gynaecology from UK, the European Society of Obstetrics and Gynaecology, then the International Federation of Obstetrics and Gynaecology, the Southeast Asian Federation, as well as the Asia-Oceania Federation. So, we are really proud to host them, and that we have 12 workshops which are happening on pre-congress workshop day, but along with that we are also going to have a skill drill station, and in these skill drill stations we are going to have the mannequins and the simulation workshops, because each person can attend only one workshop and there may be many who may not coming for the workshops because of some other commitment. So, everyone will get an opportunity to see and to work in simulation workshops, and that simulation workshops also help to gain the confidence as well as to gain the skills, and which will be very useful for youngsters, and that will happen on all the days of conference. But I think there is also a social obstetrics, and our chairperson Dr. Hema Divakar, who is now known at all international levels also and working on women's health on many aspects, and we are all there in her team. That also helps to learn about the society and what is our social responsibility. It is not only that we gain our knowledge and we treat our own patients, but also we have to spread this knowledge and we have to sensitize the not only doctors but the community and also the other health workers, those who are working with us like the nurses and the midwives, because and we have to strengthen them. So, it is not only that we look at the strengthening our members' strength, but also the people who are working at grassroots levels, the health workers who are working with us, because they are the backbone of any hospital. And we yes, everyone knows that Bangalore Society of Obstetrics and Gynaecology, we have a great team, and at the end of the day it is the teamwork, and everyone is working hard, and everyone, I can say, that is dedicated, and they are putting their 100% to see to it that the scientific program, the workshop and everything in the conference comes out very well, and the members, those who attend this conference, will be definitely happy after attending this conference. I would say that every year we come together, we learn from each other, and we always look at some take-home messages, and we are going to take care to see that each and every session they really take there are some take-home messages, and that they will carry it with them, and then they apply it to their own patients as well as the community, and which will be of a great help to our nation. So again, at the end of the day, again at the end of my talk, I would like to say that women's health is nation's wealth, and that is what we will achieve at the end of this conference.